Good evening, warriors. I'm coming in hot for a second video because I am introducing some new stuff at TLC and I want you guys to be the first to hear. So let's talk about exosomes. Now, everybody's heard of stem cells and there's a lot of controversy surrounding them. I'm here to talk to you today about exosomes. And what are exosomes? Exosomes are like the warrior of the stem cells. Now, stem cells are not legal in our country. Well, there are some exceptions, and we'll get to that because that's probably something that we're going to look into offering. But exosomes are derived from placental tissue, so people can decide to give their placenta to science. And when they do, they can make these exosomes. And basically, exosomes are cells that make everything else in our body. So they're really cool with healing. And especially for my warriors, my Lyme healers, everybody, when we get to a certain phase of healing, this is a really, really good thing. Like one of the things we're going to offer is we're going to do like EBOO, we're going to do plasmapheresis, and then we're going to add exosomes in on the tail end because we're going to clean you, and then we're going to put in all new tissues that can regenerate. So I got a shipment in. I'm going to treat my knees. Next week, I'm going to show you nasal treatment. I need a little bit of a smaller. I was gonna try and hack it, but the needles I have are not exact. And to be quite honest, to not have the numbing and then do a bigger needle, I thought probably you'd see tears coming down my face because to inject my nose, that's rough. Obviously, nasal injections, great for eyesight, great for brain fog, great for vertigo, any of those things. You do them topically. I'm going to do my knee for a couple different reasons. You guys know I struggle with lipedema. So I'm always looking for hacks for, things that are going to make my body attack the fat that is resistant, right? So one of the things you can do is you can do this. Tomorrow I'm going to show you an injection with phosphatidylcholine that helps to direct so your body will melt that fat. So obviously this is a sterile procedure. I'm not going to do it as sterilely on myself. Normally if you guys were coming in, it would definitely be sterile. So we do betadine. We're looking for that joint space. I already found it on myself. I will tip this down so hopefully you guys will see. So I already found the joint space and marked it on myself. I'm doing it on both sides. Have already, although I kind of moved to go get the numbing spray, although I probably won't be able. Obviously going to do iodine to keep it nice. We don't obviously want to introduce any kind of dirt, any kind of funky stuff in here. Now, in the before times, when I was a family practice doc, some of you might have been my patient. You might remember I did a ton of injections. That was a huge thing in my practice. This is a different kind of injection. This is a healing. This is like teaching your body to be able to heal itself. So I'm going to try and spray a little bit. And then I'm going to go in and I'm going to inject the exosomes. Little bit of a burn. Basically what I'm doing is I'm just directing it in a couple different areas. So I'm injecting back into the space and kind of moving it around. Now, obviously after the procedure, after I do the second one, I'm going to move around. So I have so it's hitting in a better space. Again, doing the second knee. You can see the freezer marks here. And out. So as you can see, relatively painless. Did it on myself. I don't know if the nasal will be quite that painless. So you might see me cry a little bit when I do that procedure. Now you can have like a flare, kind of a inflammation in the area for, a little bit after. That's common because basically what I'm doing is I'm telling my body to rebuild. I'm saying, go in there And I'm doing this for a couple different reasons. It can help with the swelling that I have in my lower legs that I'm always treating. It can also help to rebuild the knees, which is my area of greatest swelling, pain. I can always tell when I'm detoxing from sugar. I can always tell when I'm eating sugar because I have a huge uptick in terms of the pain. So I'm going to see how this works. Obviously, this is not a cheap procedure. It's not as expensive as stem cells. We do them a couple different ways. Like I said, we can inject them, nasally, which helps with brain fog and a lot of the stuff associated with being a mold warrior. We can inject them in any site of injury. I'm going to do my practice manager. I'm going to do her knee tomorrow. We can do them IV if you want them all over in terms of your body. Depending on the level and the number of exosomes you're injecting, the price changes. So obviously the more exosomes, the more expensive it'll be. I really think it's the future. It's regenerative, right? So this is going to tell my body to regenerate, to build, and to get everything done. So just wanted to reach out, just wanted to do this video. I'll give you some more information on it. If you guys aren't already subscribed, jump on my website and get on our email list. I send all this out. I will talk about deals, things we have going on, exosomes, cool stuff. I want you guys to be in the know. So even if you can't be here in person, you can hear all about it so that you can plan your family vacation to come see us. Sort of kidding. Not really. Happy Tuesday. I will see you guys on Happy Hump Day tomorrow. Big hugs.